Hello everyone, myself Dr. Rohit Reddy Paturi, consultant pulmonologist from Century Super Specialty Hospital. Today let us discuss in detail about asthma. What is asthma? Asthma is a heterogeneous disorder where you see inflammation inside the airways. It is generally caused by the allergies and when you get exposed yourself to some of the pets. How does it happen and what are the symptoms of asthma? Generally, asthmatics will face lot of difficulty in breathing. They have wheezing, they will be having chest tightness, they will be having chronic sputum production and cough. And all these symptoms will have nocturnal variation, and some people will have diurnal variation as well. And they have seasonal variation, like whenever winter comes and rainy season comes, the symptoms will aggravate. So how does it happen? What does asthma create a problem? How does it create a problem inside the airways? So there are three types of airways called as large airways, medium sized and small airways. So in asthmatics, generally airways will be like this. See, you can see the airflow will be very clear here. So in asthmatics, these airways, inside the airway, you can see the inflammation inside the airways. So causing more pressure. So person has to put lot of pressure in order to inhale and exhale. So causing lot of wheezing and lot of sputum production and coughing. Most of the times these symptoms will aggravate during the night time, especially during the sleep. When they sleep, the symptoms will aggravate. How do we diagnose asthma? So we do an X-ray just to rule out any other secondary causes. Then we do a pulmonary function test. So based on the pulmonary function test, if there is any good reversibility of FEV1 of more than 12 to 14%, more than 12%, we call that as asthma. So how do we treat asthma? So there are two types of medications. One, reliever therapy. Two, maintenance therapy. So relievers, how do we relieve? Reliever, you all see the blue color inhaler. We call that Asthalin. So Asthalin, these kind of inhalers are relievers. Maintenance therapy, how do we maintain the therapy? There are other different types of inhalers other than Asthalin. Asthalin, we call that as salbutamol. Salbutamol inhaler is only used on SOS basis. Whenever you have difficulty in breathing and coughing, then only you can use. We have other inhalers like ICS and LABA inhalers, inhaled corticosteroids and long-acting beta agonists. So these inhalers will prevent the inflammation inside the airway. So these are the main medications. So these inhalers are to be taken under the supervision and under the prescription of a doctor. So don't overtreat by yourself or don't undertreat by yourself. You can control your asthma. Asthma is easily controllable disease and it is not 100% curable. So if you can control your asthma well, then it is as good as cured. So just you have to visit your nearest doctor and get a diagnosis of asthma and get it controlled. So how do we prevent asthma exacerbations? You need to avoid a lot of things like getting yourself exposed to cold airs, ACs, fan air. If the fan air also directly hits your face also, you might get asthma exacerbation. Other things are like cold foods, colored foods and carbonated beverages and getting yourself exposed to air pollution. All these things will also trigger your asthma. Asthma, lot of allergens will be there. You need to notice and identify your own allergens for which your body is not suitable. Just notice that as an allergen and try to avoid that allergen. Most of the people will have allergies with peanuts, with citrus fruits, etc. So just notice and identify your triggers and identify your allergens and try to avoid them so that you can keep your asthma in good control. Thank you.